Can using a vibrator be considered a kink? I guess it depends on how you're using it. When I saw the movie Hysteria in theaters in 2011, I had no idea I was kinky yet, or that this goofy rom-com set in the Victorian era would be one of the things that had helped me figure that out. In the movie, Hugh Dancy plays a young British doctor named Mortimer Granville, who takes a job at a medical practice that specializes in treating female hysteria, a vague illness women were often diagnosed with in the 19th century. The so-called symptoms of hysteria are suspiciously similar to the symptoms of simply being a woman in a society that suppresses women's sexuality and personhood. Anxiety, insomnia, irritability, sexually forward behavior, you get the picture. Dr. Granville quickly learns that the treatment for this so-called illness is to massage the patient's genitals until they have a hysterical paroxysm, aka an orgasm. But as you might know, getting someone off by hand can be physically taxing, and even more so if you've got dozens of patients per week clamoring for your services. So Granville invents a vibrator to do the job more quickly and efficiently. Needless to say, it's a hit, and the patients just keep on coming. It wasn't until years after seeing this movie that I found out the truth. Yes, Dr. Mortimer Granville invented an electric vibrator, and yes, female hysteria was once a common diagnosis for women who didn't fit the typical Victorian lady mold. But what's not true is the claim that inducing an orgasm was a frequent treatment for hysteria, or that the vibrator was essentially invented for that purpose. These were just unsubstantiated theories put forth by the historian Rachel Maines in her 1999 book, The Technology of Orgasm. But knowing it's not true doesn't make it any less hot. The image really stuck with me after seeing the movie. A hot doctor strapping me into stirrups, spread eagle, and holding a vibrator on me in a matter-of-fact way, like it's so routine to him that it's almost boring. A professional having power over me, not only due to his position of authority, but also due to him knowing more about my own body and how it'll respond than I do. Because in the fantasy, I'm a docile Victorian woman, naive about her own sexuality, and waiting for someone to show me all the things my body can feel. Seeing this movie and subsequently fantasizing about it was one of my first times viewing a vibrator as a kink implement. I hadn't yet dove deep into the archives of kink.com or Crashpad series, hadn't seen pro-doms and porn stars using wands to tease and torment as they so often do. The hysteria fantasy was my introduction to the idea of a strong vibrator as a way to consensually control someone, to make them feel what you want them to feel, maybe even scare them a little with the intensity of their own response. But that's just one fantasy, and it barely scratches the surface of what's possible. Today, let's talk about why the magic wand in particular is many kinksters' vibrator of choice, integrating seamlessly with everything from medical play to bondage to orgasm control. I'm Kate Sloan, and this is Making Magic, how the magic wand became the world's most famous vibrator.
So I've done like kind of historical medical scenes that are specifically doing that hysteria thing, curing hysteria.
This is my friend Lady Pim, a pro-dom and the owner of the Toronto kink venue, The Kneeling Room. There are a lot of things she's good at, but one of her specialties is medical fetish play, also known as medfet, which includes this Victorian vibrator doctor type stuff, along with various other scenarios.
Anything you want to do, in my opinion, you can bring into a medfet scenario. And your justification for doing whatever activity you want to bring into it is some stupid medical reason that you're making up off the top of your head, right? So like, can you bring a wand into like a doctor's office? Absolutely. And you can, pretend that it's curing their high blood pressure, or that you need to test the sensitivity of the area, or you need to get a sample to take off to the lab, like literally for any old reason. And that's one of my favorite things to do in role play, is to make stupid and silly justifications for stuff I want to do to the person in the moment.
Lady Pim told me she uses the wand in her personal life more than any other toy, but it comes up a lot in her sessions with clients, too. Not just in medical play scenes, where it fits right in with its clinical, desexualized design, but also in other types of sessions.
The request usually will be for tease and denial, sensual domination, or like predicament bondage. Sometimes if that's the request, then I'll kind of add a wand or vibration into there. If people request like overstim, that's a go-to. I'll grab the wand. And then probably the last one is like a request for a quote unquote forced O. In that case, I'm like getting it right out for any of those requests. Yeah. I'm like, oh, I know how to achieve all of these things, and it's with a wand.
When I think about kinky usages of the magic wand, I immediately think of orgasm control. They're a perfect pairing. There are lots of different flavors of orgasm control: tease and denial, ruined orgasms, post-orgasm overstimulation, even, as Lady Pim mentioned, those so-called forced O's. And the magic wand works beautifully for all of them once you got the hang of using it. By the way, just so we're clear, everything I'm talking about here is consensual, usually heavily negotiated, and agreed upon by all participants in advance, even though kinksters who are into this type of play often find it hot to use words that imply the opposite, like ruined, tortured, and forced.
The fantasy is that it's forced. So the reality is that they're requesting for it to feel like I'm doing this thing to them, and they can't do anything about it. The reality is that they obviously really love to have that orgasm, and they like to have it in a way where it feels like they're out of control and they're helpless and they're stuck, and I'm overpowering them, and I look so hot and powerful while I'm doing it. Yeah, forced O can include like some sort of dirty talk that kind of enhances that helpless feeling as well. But with dirty talk like that, of course, you always have safe words set up so that you know if they're truly wanting things to stop, then they will say their safe word. So a stoplight system is common for that, where a red would be a complete stop of scene. A yellow can mean to like check in and see what's going on and then kind of alter your play and then continue. And a green is absolutely go. So anything else they say is game on.
I saw the movie Hysteria when I was 19, but it took me years after that to work up the nerve to actually ask somebody to use a vibrator on me in a dominant way, taking control of my pleasure and orgasms while I was strapped down and squirming around. When I did finally try it out, it was as good as I'd envisioned, even though it didn't take place in a Victorian doctor's office, but in my own bed. And it was one of the major things that made me go, yeah, I think I might be submissive. I'm going to do some more research on this whole kink thing. Turns out this whole kink thing is a big piece of my sexuality. I even wrote a whole book on it eventually. I've learned a lot about what I like by exploring all sorts of raunchy proclivities with partners over the years. But I've also learned a lot from my kinky friends, including my best friend and my co-host on my other sex podcast, The Dildorks, Billy Lore.
I'm Billy Lore. I'm a sex and kink educator and porn maker. My first magic wand, it was a hand-me-down from my partner at the time, who was like long distance and mailed it to me. And then the first one that I bought was the rechargeable when I started working at a sex toy store and was able to get my employee discount and was selling it to everyone and was like, yeah, but I need it though. Currently, the magic wand is pretty much the only vibrator that I use. The only time I'm reaching for another vibrator is if I want to use two vibrators, and the one I'm already using is the magic wand. My second most used vibrator is one that I'm like, this vibrates almost exactly the same as the magic wand, except it's slightly more insertable. Not to say that I haven't put a magic wand inside me, but you know, ergonomics.
I'd say that I have a pretty straightforward relationship to orgasm. It feels good. I like it. But in chatting with Billy about sex and kink on our podcast every week for nearly 8 years now, I've learned a lot more about how he and many others complicate their relationship to orgasm by playing out kink scenes where they're forced to come or instructed not to come and consensually punished if they do by getting severely overstimulated post-climax right when they're most sensitive. Billy likes to do this type of scene both in his personal sex life and in the porn he makes with other people.
I have this clip that is a like overstim, overwhelm scene where I have a different toy on my junk and the person is got me like right up to the edge and is making me ask permission to come, and I do, and he tells me, you can come whenever you want. You may not like what happens when you do, but you can come whenever you want. And in watching the video back, I see him as he's saying, you may not like what happens when you do, reaching over for the magic wand and just holding it. And I'm like, that's some foreshadowing right there. That is perfect, because that intense rumbly vibration right after an orgasm is going to be incredibly overwhelming, right? However, for me, because the magic wand has such a deep vibration, it has that like low earthquakey rumble, it is the kind of overwhelming that is tolerable in that situation, whereas something that is like really intense and buzzy would be overwhelming and dissatisfying. And the thing is, with this kind of intense sensation, when we're playing with overwhelm, it does parallel pain somewhat, right? It's not entirely dissimilar from pain. It's overwhelming my sensory systems in a similar way. But when you're using something really rumbly like the magic wand, that discomfort, that intensity is so much more sustainable.
Of course, when someone's holding a super strong vibrator on you right after you've just come, you're not going to be at your most articulate if you need to communicate something, like, please stop, or please don't stop. Which is why a lot of kinksters who do this type of play will agree in advance on not only safe words, but safe signals.
If you're a person who goes nonverbal when you are overwhelmed, right, or finds words hard, it may be helpful to have some sort of visual cue, right? Like, I have a background in martial arts, so I will double tap on my partner if I need them to, like, check in and I don't have the words to say that, or if I'm wearing a gag or anything like that.
Crash Pad series director Ava LaPrima, who also used to work for kink.com, told me that she and her colleagues take these safety measures seriously when shooting kinky porn scenes, too.
For the most part on Crashpad, we allow performers to direct themselves. But oftentimes in BDSM and bondage scenes, you want to establish safe words and just have clear communication at all times. One of the cues that performers can use if they have something in their mouth is go 3 times or just make some other kind of vowel sounds. Also at Crashpad, we ask performers just to look directly at the camera or look at us and then we'll immediately check in with each other like, whoa. Hey, what's going on? Do you need water? Do you need lube? Do you need a break? Whatever. And we always allow them space and time to collect themselves, and then we could go ahead and proceed with the scene.
There's a common misconception that safe words and other such safety protocols are more for the benefit of submissives, but really they benefit everyone. It's much easier to enjoy yourself and go with the flow of a kinky scenario if you know you can trust your partner to pay attention to what you need and communicate what they need. That's true whether you identify as a dom, a sub, a switch, or something else entirely.
We're not putting all of the responsibility on our tops to read our minds, but we can give them some tools to help decode our body language so that they can course correct in the moment if they see you starting to reach that point.
As Billy alluded to there, he and I both usually bottom for this type of play, meaning that usually our partners are the ones holding the vibrator on us and not the other way around, although, we dabble. Being on the top side of the equation can be intense in a different way. And for advice on this, I consulted one of the most prolific tops I know, Danarama, former director of Kink University and a founding member of the two Knotty Boys rope bondage duo. In watching his scenes, I've seen him use a magic wand on someone through a latex catsuit. I've seen him hold a wand against someone until they squirted. I've even seen him use 3 wands on someone at once, one on their genitals and one on each nipple. Clearly, he's got a high skill level in this area. But I was curious, did using a wand on people always come easily to him, or was there initially a learning curve?
Well, there wasn't a learning curve because the thing pretty much drives itself. I mean, the nice thing about the original Hitachi is that it had like off, high, or low. And it wasn't like the Morse code that you have in modern wands today. I've been fortunate that I've experienced a number of partners who I was their first introduction to the magic wand. And it was pretty self-explanatory. And the main learning curve of a magic wand is location, and pressure. The trick of that is you don't want to dive in like a turkey dinner and just like mash that on the little man in the boat. Allowing the other person to guide the pressure at the first touch is the most important thing because everybody is different. Everybody is different at a different time. Some people can take it more than others.
Ava also had some practical tips for using a wand on someone.
I think just make sure you don't lose control of your magic wand. It can get slippery, especially if you're playing with lube. I think what we used to do at Kink is wrap the vibrator in vet wrap. It's like a sports tape, because if your hand is lubey, it could lose your grip on it.
It'd be easy to assume that the kinkier someone is, the wilder their toy collection will be. Maybe regular old vibration won't be enough for them anymore, and they'll get into electrostimulation wands or vacuum beds or urethral sounds instead. And while there are a lot of kinksters who are into more extreme equipment of that kind, myself included, many doms I've spoken to, including Danarama, also love the magic wand, because it does what it does consistently and well. Dan told me about how the wand's simple design and dependable mechanics make it an ideal tool for his creative scenes at kink.com.
At Kink, it's about simplicity because a lot of stuff is very complex. You've got a lot of these toys are tied on the model, or they're attached to some sort of device, or they're attached to a fucking machine. And with all that complexity, it's much better to have the simplicity of an easy to access button and reliability. There's so much complexity going on with rope and with other toys and with action and with sex. And the last thing you need to do is to pause and try to figure this thing out. The sheer power and consistency of it is really important to have in a scene like that. Because you want to be, as the dominant, you want to be in control and understand all the response that's happening. I'm the dom here, not Mr. Hitachi.
Another dom I knew I wanted to speak to for this episode was Sinclair Sexsmith, a writer, kink educator, and the editor of some of my favorite kinky erotica anthologies. Actually, their being an editor was directly linked to how they got their first magic wand.
In college, I worked at like a student writing center, like as an editor and support person for people could bring their papers in, and we would like give them feedback on their work and make their paper better, basically. And I remember we often had times when the folks who worked there were just sitting around shooting the shit because we didn't have a lot of people coming in some days. I remember talking to someone there about the magic wand and saying like, oh, I've seen that, like, a girl that I dated had one. And I just thought it was, basically the lawnmower of vibrators. And, sometimes people joke like you have to start a lawnmower, like you have to pull the crank, like vroom, 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 to like get it going. And I was just like, that is so intense. That one is so intense. I don't think I can even ever use that, like, so much. And she was like, yeah, I thought that too, but then I got this attachment for it. It's not quite as intense. And that's a good time. And I was like, oh, note to self, right? And so eventually I picked one up. Now it's really almost the only vibrator that I use, and it's the only vibrator a lot of the people that I date use.
Sinclair told me that as a dom, they like using the magic wand on partners, but they also really like telling a partner to masturbate with the vibe in front of them.
And just watching, like sometimes from across the room, even like just sitting casually and being like, use this and get off. However they like to come, I would tell them to do that or ask them to do that and show me and show off. A little bit of objectification maybe, but kind of in a like, you're going to be my entertainment. You go over there and do this and make it pretty, and I'm just going to sit here and watch you. And I think that is really fun.
I found this interesting in light of some of the conversations I had last episode about porn, and how there's kind of a schism in the porn viewing community between people who get annoyed when the wand blocks their view of the action and people who think watching someone use a wand is really fucking hot. It makes sense that someone like Sinclair would be into it, because seeing a partner react to strong sensations is a big part of what many doms and tops enjoy about kink, whether those sensations are painful or pleasurable or even both at once.
If I'm doing something that's more on the side of like playing with pain or playing with sadism and masochism, sometimes I will get it out and hand it to, like, turn it on, hand to someone and say like, use this. And sometimes if someone is like not just like melting into receiving, a paddle or a cane or a flogger or fists or whatever that we're using for impact, more erotic arousal can sometimes mean they can either take more or they can melt into it more, where their body can like relax and release, which is what I love about impact, is actually the like somatic release that can happen. I mean, I like the suffering too, so don't get me wrong, but I love the somatic release, and I think that stuff is really valuable just for human bodies to like let go of some of the things we're holding.
That big, cleansing, emotional release is one of the things I like about sadomasochism too. I'm not talking about orgasm here, although, as we've discussed, orgasms are great, but rather about the way that taking a heavy spanking, for instance, can make me cry and scream and stay present in the moment in a way I struggle to do in everyday life. Pain does this very effectively, but it's not the only thing that can prompt this type of reaction. Tina Horn, author, podcaster, and kink educator, explained it like this.
BDSM is so much about intensity of sensation. And when people think about it, they think about pain, which they should. But a lot of the time, it's also just like, what a fascinating sensation, or what a new and novel sensation.
Kinksters will go to great lengths to experience new and novel sensations, as anyone who's ever tried fire play, figging, or cake sitting can attest. If we expand our definition of sensation to include mental and emotional responses, that opens up the possibilities even further. And one emotion that many kinksters like to play with is humiliation.
When I worked as a professional dominatrix, I would use the magic wand. Either I was using it on them, or I was doing what we called a toy show, or tease and denial, or where part of the idea behind the scene was that I was getting myself off in an exhibitionist way, better than the client ever could, yada, yada, yada. You're a tiny, puny, little, pathetic excuse for something that's supposed to give orgasms but doesn't, also known as a man.
I was surprised by how many kinksters mentioned in our interviews that the magic wand could be used for humiliation play, because it's not something I'd really considered before. Listen to what happened when I asked Lady Pim about the teeny tiny magic wand micro, which had just launched at the time that we spoke. I know you mentioned that you like the electric one the most, but I wondered if you had thoughts on the line in general in terms of the plus, the mini, the new micro. Have you seen the micro? It's so cute.
It's adorable. I haven't used that one yet, but my immediate thought upon just seeing it, I was like, that would be great for SPH. That would be great for small penis humiliation, right? Because you could get out the regular size wand, and then you could look at their genitals and be like, oh, yeah, no, we don't need this one. And then you come back with the tiny little vibrator. That's such a funny bit. That's so brilliant. I love your brain. I asked Billy about the kink potential of the different sized magic wands, and he had a few thoughts on the smaller ones too.
I'm mostly excited about it because it's so tiny and cute, but that's very much a sex nerd thing. I think I did also do a fun scene where, there is the fun in using the small one and being like, oh, we need to take out the big boy for this one. Ooh, you could use the mini or the micro for some kind of giantess size porn kind of shit, where it's not mini, I'm just huge. And get a bunch of other small scaled down things. Anyway, I have new ideas now.
As I worked on this episode and talked to all these kinksters about the role the magic wand has played in their lives, it became clear that for some people, it was more than a toy, a tool, a means to an end. Could it maybe even be considered a fetish object?
Oh, what a cool question.
Tina's latest book, Why Are People Into That?, has a whole chapter on foot fetishism, which goes into the history of highly fetishized body parts and objects. So of course, she had an answer for me.
Sexual fetishism was codified in the 1950s in the first edition of the Diagnostic and Statistical Manual of Mental Disorders. So, the entire idea of a fetish, the binary of normal and abnormal sexuality, right? Because it comes from the need or the sense of need of medical institutions to codify what is normal so that they can codify what is abnormal so that they can diagnose it and treat it. So essentially, our modern concept of fetishism is based on the idea of sickness that can be cured by institutions. And we all know what kind of biases are going on in those institutions. My reading of this material is that if you like something sexually more than you like intercourse, you're a sicko. It's like, can we talk about what it means that our concept of sexuality, broadly speaking, in the West, like in the 21st century, based on this normal, abnormal sexuality binary that needs to be collapsed, but also that, like, if you like a non-sexual, lots of scare quotes in this conversation, like if you like a quote-unquote non-sexual object more than you like your husband's dick, that there's something wrong with you. And then in like later editions of the DSM, there was like some effort made to talk about the difference between like a fetishistic disorder that like causes distress to the person as opposed to like a fetish that doesn't cause distress, in which case it's fine, I guess. And so like by this criteria, could we say that the magic wand is a fetish object? I'm no doctor, but based on my interpretation of what I've read, it seems like if you really love your vibrator and you get off to your vibrator more than you get off to partner sex, as long as that's not causing you distress, it's fine, it's good. But I think that distress often like gets internalized, right? Like we like feel that distress because it doesn't comport with the person that we think that we're supposed to be. I mean, even masturbation is persistently seen as like sex's consolation prize, right? Or like a stopgap on your way to quote unquote real sex. And I think that a lot of people are probably distressed by the idea that they would rather jerk off with their magic wand than have mediocre sex. But maybe everyone should work on not being as distressed about that. Like, what would happen if we stopped worrying about that so much and just experienced that pleasure?
My favorite thing about kink is that it can be whatever you want it to be. It's an intentionally expansive term that invites you to design your own sex life from scratch instead of just grabbing one off the rack. I like to think of kink as grown-up playtime, a space to explore and experiment and learn more about what my brain and body are capable of. While some people see kink as a sexual orientation, a political act, even a spiritual practice. It can be a way to reclaim power that the world at large has denied you, or a way to relax and surrender when life gets hectic. You can really do whatever you and your partner or partners agree on, as long as you approach it in a careful and consensual way. Likewise, the magic wand can kind of be whatever you want it to be too. It might be an instrument of orgasmic torture in your predicament bondage scene, and then a soothing comfort for massaging sore muscles during aftercare. In role plays, it can be brandished by scary kidnappers, gum-snapping mean girls, or bossy doctors. It's a blank canvas of a vibrator, consistently serving up powerful vibrations. It's up to you how you want to put those vibrations to use. Speaking of blank canvases, next episode's going to be all about art. Talented creators have immortalized the magic wand in everything from film to music to sculpture to stained glass to tarot cards, and I'll chat with a few of them about their work. We'll dig into why the magic wand is such a prolific muse, and I'll tell you about some of my personal favorite pieces of magic wand art, including the one that's tattooed on me. Until then, keep on making magic. Making Magic is hosted and co-produced by me, Kate Sloan, edited and co-produced by Jamie Pityinger, and made possible by the generous support of Vibratex, with art by Addison Finch. Special thanks to my guests for this episode, Lady Pim, Billy Lore, Ava LaPrima, Danarama, Sinclair Sexsmith, and Tina Horn. You can find links to their work in the show notes.